It's Thursday, June 30th. Birth control's not banned unless someone says it is. We start here. Facing a vague trigger law, a Missouri hospital suddenly stops prescribing Plan B before allowing it again.
I think it just speaks to the confusion in the wake of this Dobbs decision.
We'll walk through the head-spinning policies on all sorts of reproductive health drugs. Russia didn't want a NATO member on its border. Well, now it's got two more.
He wants less NATO. President Putin is getting more NATO.
What this expansion could mean for future conflicts. And it's a conversation between a patient, their doctor, and their insurance company.
I've been paying out of pocket. I spend about $1,000 to $1,100 a year.
Why some transgender patients can't get care covered that medical experts say could save their lives. From ABC News, this is Start Here. I'm Brad Milkey. When Roe v. Wade was overturned, many legal observers sprinted from reading the Supreme Court ruling to more than a dozen state trigger laws that were poised to take effect. What was about to be banned in those states? Surgical abortions, certainly, but what else? That's what I asked the Attorney General of Arkansas.
Is the abortion pill included in that?
But then she started talking about Plan B.
When you're talking about the abortion pill, if you're talking about Plan B or contraceptive, then no, it does not. Plan B is what they're commonly called. It's not included.
I was not asking about Plan B, though. That's the morning after pill, which prevents pregnancy from happening in the first place. Now, I was asking about abortion pills, the two-drug regimen that actually terminates an existing pregnancy, which I clarified.
Like medical abortions, where it's not necessarily a surgical thing, but there are drugs, a compound of drugs you can take. Would those be considered illegal if it's beyond those first few days?
Well, when we see, and that's something I think is going to be hashed out in the courts.
But she seemed almost confused by this distinction, which was strange since medical abortions make up for half the abortions in this country. But she isn't the only person who sounded confused about pills this week.
There's confusion, shock, concern, a lot of questions.
In fact, yesterday we learned the largest hospital system in Missouri had not only stopped providing medical abortions via pill, but they were no longer even providing Plan B contraceptives to patients. Let's get this sorted out with ABC's Ann Flaherty, because Ann, legal analysts were assuring women they should not be worried about contraceptives going away right now. Well then, women in Missouri were just told they couldn't get these contraceptives. What is happening here?
Right. This was a big surprise. We heard on Wednesday that St. Luke's Health System had been denying these Plan B, this is the emergency contraception, to sexual assault victims. So this was first reported by the Kansas City Star, and they confirmed it with the hospital system. This is a very large hospital system in Kansas City that said, look, we're concerned about how the law is written. It's very vague. We want to protect our staff, and we don't want to run afoul of the law. We want to be lawful. They made clear, too, that they don't support the abortion ban, that they think that women should have access to lawful abortion. So, a lot of confusion here. Then we went to the Missouri Attorney General, who said, we've cleared this up. We've made clear that the law does not apply to Plan B, and they can resume giving this out.
Birth control is still legal in the state of Missouri. Emergency contraception is not an abortifacient.
I think it just speaks to the confusion in the wake of this Dobbs decision. A lot of the states, saying that abortion is illegal, including the medication abortion, but people confusing that, quite frankly, with Plan B, which is not abortion. It is a contraception.
And does that create even more panic for people who, we're seeing people rush to stores looking for Plan B?
Right. We've confirmed with several of the pharmacies, CVS, Rite Aid, Walmart, Amazon, that they are limiting purchase of these Plan B contraception packages.
We have in stock now, but eventually we will run out too.
One of the concerns that they have is resale, that people are going to try to exploit this situation and sell it for to the highest bidder. I think the other concern is that women are panicking and they're running out and buying this, and then you're going to have a shortage, much as we saw with the baby formula. And Plan B has been a flashpoint within the conservative movement on abortion. And the reason why is the way that it works.
Emergency contraception is a safe way to prevent pregnancy up to 5 days after unprotected sex.
It works in different ways. It can prevent you from ovulating. It can prevent the sperm from reaching the egg and fertilizing the egg. Now, the medical community says it can't be something that causes an abortion because it prevents you from getting pregnant in the first place. So it's not until that fertilized egg is implanted in your uterus that you would be considered pregnant. And once you are pregnant, there's nothing that this Plan B could do. So that's why they don't consider it an abortion. But there are some groups within the conservative movement who would say this absolutely is the destruction of life. I think that's the term that they would use because they would say we were talking about a fertilized egg. So a lot of confusion on this.
But so at this moment, is Plan B good to go in all 50 states, or is there a chance that that comes off the shelves in certain places?
So it's unclear. As the laws are written right now, none of these laws specifically go after Plan B. And I should point out that in states like Oklahoma, they specifically said this does not apply to Plan B because they know that confusion exists.
Oklahoma's bill explicitly allows for the use of the Plan B pill, but prohibits medical facilities from using the emergency contraceptive.
There's certain groups within the conservative movement that would want to put this on the table. It's not there yet, but I think that just all speaks to the chaos that's happening in the wake of the Dobbs decision.
Well, and if we're talking about chaos and confusion, let's talk about the federal level, because the White House is saying not only are contraceptives not banned, they're good to go, we're going to protect them, they say, but they say they're going to make sure people get access to those abortion pills, the ones that do terminate pregnancies, if people want them. How would that work, though, if a state that somebody's in has already specifically banned them?
So right now, the administration has not given us many details on this. And I think there's a couple points to make. One is that the federal government can't spend any of its money as of now on abortion. There's a restriction called the Hyde Amendment. It tends to get tacked on to every appropriations bill over the past few decades. It's been in play. So the federal government can't really do much on this.
There is no magic bullet, but if there is something we can do, we will find it and we will do it.
The Biden administration might argue that because the abortion pill is regulated by the federal government, it's approved by the FDA, and the FDA says that you can take it through a telehealth appointment. You don't even need to go see a doctor in person. That these state laws essentially run afoul of the federal law.
State laws that say you're not allowed to have a telehealth medicine, you're not allowed to send away for an abortion pill.
Right. And in fact, there's a court case that not many people have paid attention to. It's called Gen Biopro v. Dobbs, that's in the Mississippi court system, the district court system now, that Gen Biopro, which is the maker of the abortion pill, is making that exact point. They're saying that, this actually has nothing to do with abortion. This has to do with our ability to sell a product that's been federally approved and is allowable under federal law. And federal law always supersedes state law.
Working to increase access to this drug is a national imperative and in the public interest.
The other thing that they can do is try to relax some of the regulations around it. Right now, the FDA says you have to be a registered clinician to give this out. I know that the makers of this abortion pill would like to see it available in pharmacies and administered by pharmacists that would make it much more available. And, it can be mailed. If you get to California, it could be mailed to someone's home without ever having an ultrasound or seeing a doctor in person. I mean, it's really not tightly regulated in states like California and New York. So the question is, how do women in Arkansas and South Dakota get to these states where it is less regulated?
Right, and that's the thing, because you got abortion rights advocates saying, hey, travel out of state. We will find you a place to stay. Maybe your employer will pay for your travel, but we keep hearing over and over that the person that's most likely to need an urgent abortion is also the person who doesn't work for like a big bank or who can't take time off. Women of color are particularly susceptible to not having all those resources. So what happens to those women?
So one concern with these state laws is that some of them have written into it that it's a violation of law for aiding and abetting, and nobody knows what that really means.
Patients who are struggling to make ends meet, who are deciding, do I pay my rent or do I feed my kids? And now they have this not only added expense and time of needing an abortion, but also the time they have to take off work and the childcare and the lodging.
The groups I've talked to say, look, free speech, I can tell women how to get out of state, and I can tell them where they can find an abortion in a state like California or New York. But I don't know that that's clear, and it might be tested in the courts. So people are being very careful. I think you are going to see groups of women, particularly in states like Colorado and Illinois, where they're surrounded by anti-abortion states. And I think you're going to see an underground develop and women taking other women in and helping them get where they need to go.
Fascinating. All right, Ann Flaherty, thank you so much.
Thanks, Brad.
Next up on Start Here, how's keeping NATO off your border working for you? We're rushing back in just a bit.
With so much at stake, so much on the line, more Americans turn here than any place else. ABC News World News Tonight with David Muir, America's #1 most watched newscast, now streaming on ABC News Live.
You never know what you're going to get on this show. That's all I'm going to tell you.
Yes, Whoopi!
This mic on? Can you hear me out there?
Behind the scenes is always a better show.
Absolutely, absolutely.
That's what people don't see during the commercial break.
Right, they don't.
What happened?
I had no idea really what I was getting myself into.
That day that we walked out, I treasure that day. I couldn't sit there.
You're doing good, Joy. You're doing good.
Oh, yeah, baby.
It was crazy.
Behind the Table. Listen wherever you get your podcasts.
Elizabeth Holmes found guilty on 4 counts of fraud, facing the possibility of decades in prison. Now, we take you inside the courtroom and behind the scenes. The Dropout, Elizabeth Holmes on trial. Listen wherever you get your podcasts.
National parks are incredibly safe places, but crime will happen.
My wife had fallen. She's in really critical condition.
At that time, I thought it was just a tragic accident.
There's still a lot of questions we need to ask.
There were small things that didn't totally add up.
This is 2 lives for Harold that have died now. I was shocked. Something's not right.
When Vladimir Putin made the decision to invade Ukraine, he talked a big game about a shared culture and history and how Russia's neighbor was now controlled by fascists, which, spoiler alert, it's not. But anyone who'd been watching this buildup knew it wasn't just about either of those things, it was also about NATO.
Our actions will depend not on the negotiation process, but on the unconditional security of Russia.
There was a concern that as Ukraine became friendlier with Western Europe, Russia could end up with an allied military force right on its doorstep. That was unacceptable to Putin. Ukraine still has not joined NATO, but yesterday, 2 other neighbors of Russia did. Colonel Stephen Ganyard was Marine and State Department official before becoming an ABC News contributor. Colonel Ganyard, this happened during the big NATO summit in Madrid. Sweden and Finland had never been in NATO. Now they are. How significant is that?
Significant indeed, Brad, but how significant and whether it was something that Mr. Putin anticipated might be a risk when he invaded Ukraine is something that we need to keep in mind. So it is very important in the sense of geography. So Finland will represent the longest part of border with Russia of any NATO country.
The alliance would gain 2 very well-established democracies with meaningful military capabilities.
Both Finland and Sweden had for years, in fact, in the case of Sweden for well over 100 years, had remained neutral. And Finland, after World War II, because they had been cowed by the Russians to remain neutral, had kept their neutrality as well.
President Putin has not succeeded in closing NATO's door. He is getting the opposite of what he wants. He wants less NATO. President Putin is getting more NATO by...
So to bring both of those Scandinavian countries, sort of the northern flank of Russia and northern flank of NATO, and bring them under the NATO umbrella is something that Mr. Putin never wanted to see, but surely must have known was a risk.
But isn't this the opposite of what Putin had been fighting for the entire time? Like, you wanted to avoid a NATO neighbor. Great, now you've got 2 just in a different part of your border.
It's not what he wanted, that's for sure. But remember what he does want, and that is to go back to the days of the Tsar and to reinstate the Russian Empire. And the Russian Empire traditionally held what is now Ukraine. And so it has always been his goal to bring Ukraine back into the Russian Empire. He surely must have known, or at least anticipated when he invaded Ukraine, that it would have been a risk driving Finland and Sweden into NATO's arms.
Таких проблем со Швецией и Финляндией, которые, к сожалению, есть с Украиной.
So, is it the worst thing in the world for him? No. It'll be the worst thing in the world for him if he doesn't take any more ground than he has up to this point in Ukraine, and he's forced to declare some sort of an end of the war with the minimal territory that he does have in Ukraine. So, it was a risk.
But if he can get Ukraine, then Sweden and Finland are like a small price to pay to him in the big scheme of things.
You bet. He kept his eyes on the prize, and the prize was Ukraine, and reinstituting and reinstating the Russian Empire. And if that required pushing his northern neighbors of Finland and Sweden into the arms of the West, then it would have been worth the price.
Okay, so that's Russia. What do you see now when you look at NATO for the West? Because NATO, by the way, made some changes here. For the very first time in its history, they identified Russia as a threat. They've been calling them a partner for a long time. They also brought up China by name, which often they don't because everything's based in the Atlantic. I mean, where does NATO see itself in this world right now?
Yeah, this is an interesting dichotomy where NATO understands, the charade is over, where we can't say it's Russia who is the threat to NATO. It is Russia that's the threat to NATO. But in the past few months, if not years, the rest of NATO has seen how China can be a bully, not only in its own backyard, but in the rest of the world as well.
China is not our adversary, but we must be clear-eyed about the serious challenges it represents.
And so not only do we have NATO calling out Russia by name as a direct threat, but now you have NATO coordinating on its efforts to deter an aggressive China.
Including on cyber defense, new technologies, maritime security, climate change, and countering disinformation.
So that is very interesting because now you have the North Atlantic Treaty Organization that is concerned and coordinating and pushing back against a belligerent China, which is really on the other side of the world.
Right, exactly. All right, Colonel Stephen Ganyard, thanks a lot for the perspective.
Thanks, Brad.
We talked earlier about the confusion that many states are going through with reproductive medications. And you might think, well, the legal landscape is so new that it'll just take a second before all the states iron it out. But it's worth noting that in some areas of medicine, patients will tell you that leaving decisions up to states or individual doctors does not necessarily get less confusing and convoluted as time goes on, especially for transgender patients.
What kind of health care are you getting when it comes to your gender-affirming care?
When I started transitioning at 20, I had health insurance, technically, and it didn't cover anything.
And today, on the final day of Pride Month, ABC's Kana Whitworth has been speaking to patients who say that life-saving care is often not covered by their insurance because it's seen as not life-saving enough. Kana, thanks for being with us. I was just thinking about this when we were hearing debates over laws regarding the life of the mother. But often that phrase is only describing kind of physical conditions. There's lots of psychological conditions, especially when you talk about the trans community. There's psychological components that could very much be considered life or death.
Yeah, Brad, I mean, that's absolutely right. So it's not just insurance companies. A lot of people consider these procedures that some in the trans community are trying to get, they view them as purely cosmetic. But if you talk to people in the transgender community, for them, very simply, it can be a matter of life and death. And it's not just physical appearance. A lot of people that are seeking these gender-affirming surgeries experience a medical condition. It's called gender dysphoria. And so what that is it's a mental stress and discomfort that those who identify as a different gender than the one they were assigned at birth can face.
Imagine every time you get out of the shower, you see and look in the mirror, and you're horrified by the fact that you have the wrong body parts.
They view those surgeries, and many in the medical community view these surgeries as a form of treatment to gender dysphoria.
And people always say, why are they, choosing to become this? And their point is, look, I've been this inside all my life.
For those who might be confused about why it's life or death, I want to point out that according to a study from the Williams Institute done in 2019, it's estimated that nearly 82% of transgender individuals have considered suicide.
Wow.
And even more astonishing, 40% have actually attempted it.
Wow. And so when we talk about gender-affirming care, what sort of procedures are we talking about that are kind of up for discussion here?
Yeah, that's really important. I think this is where people consider it cosmetic, because we could be talking about top surgery or breast removal surgery or facial feminization surgery, things like that. Those are the kind of treatments that oftentimes people are seeking out that then are considered cosmetic. And this happens after a lot of these individuals have already sought hormone replacement therapy for years.
And so when was the first time you said out loud, I want to be a boy, I want to be a man?
I was about 11 or 12 years old.
I actually traveled to Dallas, Texas, and I met with Chase Riley.
I can only remember how much I wanted to be a boy growing up and how deep down I had to bury those feelings because I never felt like anybody would understand.
Chase is someone who has been doing hormone replacement therapy and psychological therapy for 8 years. And the day that I met Chase, was actually the day before he was going in for his top surgery.
What are some other things that you're looking forward to doing the most once you've recovered from your surgery?
Taking my shirt off in public, no matter how small my chest is, I'm always in the back of my mind feeling like I'm just a girl with her shirt off.
While he was very excited, and he also said that he believed that that would be the sort of end of his journey for him. At the same time, he was also saying goodbye to the woman that held on for so long.
And sometimes I see myself and sometimes I see her. I don't really feel like I'm always in control of who I see. And I think this will just be a really big step for me to grant that physical freedom.
And then he was faced with the exorbitant costs of that.
The national average for paying out of pocket is about $100 a month.
Oh, really? For your hormone replacement therapy?
More or less, which checks out because I've been paying out of pocket. I spend about $1,000 to $1,100 a year.
He told me that he really wrote off insurance long ago. And then he was trying to save for his breast removal surgery. And what we're seeing a lot of people in the trans community do is actually turn to social media and turn to GoFundMe pages to help raise the money for these procedures.
That's the best way that a lot of people can think to fund their surgeries because I'm just a normal Joe Schmo. I don't make a bunch of money. And when I do, it usually goes back into my bills account so I can stay that much more ahead on next month's rent and next month's bills.
I mean, these procedures can range anywhere from some $2,000 for an individual procedure to over $100,000 for more extensive transitions.
Wait, and Kana, if medical experts are saying something isn't medically necessary, like this person, psychologically could just be destroyed by this, are insurance companies allowed to come back and be like, no, it's not? It's cosmetic. We don't think it's actually necessary.
So, Brad, it's interesting because it ranges from insurance company to insurance company, but also state to state. And Medicaid does cover some of these procedures, but not all. And so the spokesperson for the Centers for Medicaid and Medicare Services told us that they're aware that certain states have announced that they could issue legislation or rulemaking related to this gender-affirming care. And they are saying that they will review any such state action. But what we're looking at currently is that there are 24 states and Washington, D.C. that prohibit transgender exclusions in healthcare. Yet, 10 states have Medicaid policies that do specifically exclude trans health coverage.
Oh, that's interesting. So it matters where you live. Like your state could say, this won't be covered here.
Yeah, that's exactly right. We also spoke with Mia.
For trans people, it's safety, it's security. This is our one life, our one body.
And for her situation, she actually was able to have her top surgery covered by Medicaid.
And the doctor basically told me straight up, you don't have a choice in what you get for your breast. I pick for you.
But also wanted to have facial feminization surgery. And so she had to find additional ways to cover those out-of-pocket costs and even travel across state lines.
I'm working basically 4 jobs just to get something that I need done and done well.
Transgender is the only decision we make in this process. That's the vessel to get from point A to point B. So I never really wanted to be trans. I just wanted to be a boy.
And this battle is being fought across this country, while at the same time, the American Medical Association has classified gender-affirming surgeries as medically necessary.
Kana Whitworth, really interesting interviews. Thank you so much.
Thank you, Brad.
And one last thing. Say goodbye to the Airbnb bash. When bars and event venues closed during the pandemic, people who were determined to break CDC guidelines found their workaround: supersized house parties. You might remember these brazen house parties where dozens, sometimes hundreds of people would descend on a residential neighborhood to let loose. Airbnb got so many complaints it temporarily banned these one-night party rentals. And a funny thing happened. Everyone seemed to breathe a sigh of relief. Complaints about these obnoxious parties, which have been growing well before the pandemic, suddenly dropped by almost half. So this week, Airbnb announced it is making its party ban permanent.
The company says the drop in parties has received positive feedback from rental hosts and community members, so the policy was made permanent.
No longer will big parties be allowed. In fact, if you don't have any reviews, you're not allowed to make one-night rentals on big party weekends like the 4th of July. Now, don't get too excited, condo boards of America. Airbnb is getting less strict on how many guests can stay at a house. Used to be you weren't allowed to show up with more than 16 guests in tow. Well, now Airbnb says it's got houses capable of hosting way more than that, so there is no limit. But homeowner advocacy groups say this represents the bigger problem with what Airbnb has become. It was designed for people to rent out their spare bedroom for some pocket money or recoup the cost of vacation by letting someone stay at your place. Now you've got apparently estates capable of hosting, more than 20 people comfortably? These are not generally mom and pop properties, which is why some critics say if you really want to funnel money into a local community, it might be time to check back into an old-fashioned hotel and get your party on at the reopened bar. Also, for all you people saying, well, how would you even know if I was hosting a party? The host is barely ever there to greet me anyway. Even if there's not a security camera, which Airbnb hosts are supposed to tell you about, you really don't think a neighbor is itching to tell this person, hey, your annoying guests were at it again this weekend. Never underestimate annoyed neighbors, I think is a good lesson. Start here tomorrow. Hit that follow button for a new episode every weekday. I'm Brad Milkey. See you tomorrow.